What are the questions that the medical community is still looking to be answered about this virus at this stage?
We really don't understand why it picks on certain cities to take off. For example, in the US, the entire West Coast, San Francisco, Los Angeles, has as much contact with some of the initial hotspots in Asia, and probably more than Seattle. Why did it take off in Seattle? We really don't understand that, and we really haven't seen it take off to that extent yet in the other cities in the West Coast. And then we have New York. New York has a lot of reasons to have severe transmission, but other cities in the East Coast have not had the same experience. Boston had a big local outbreak, and it really hasn't taken off to the same extent. These asynchronous outbreaks are very unusual, but what this means long term is that I think we're all going to have to deal with flare-ups for a period of time, which may not be very good for getting people to move around except locally.
And the flare-ups are of particular concern to others that we've spoken to this week. What about reinfection? What is the early data telling us about the likelihood of reinfection when you look at the characteristics of this virus? Is it possible to have COVID-19, be cured, and then be infected again?
Most of the data suggests that we're not going to see much reinfection. These viruses may give you immunity for a period of time. We don't know about this long term, but we don't even know if this virus is going to stick around. We have other seasonal coronaviruses, and they just cause common colds, and they come up in the northern hemisphere in the late winter. This virus is totally different. The only previous experience we have is with SARS and the Middle East respiratory syndrome, and those viruses have totally different characteristics, even though from a virologic standpoint, they're closely related. So there's so much that's unknown, and I think we have to identify what we know and what we don't know. And that's where we are right now.
Hi, I'm Emily Tan, and thanks for watching CNBC. You can check out more of our videos by clicking on the boxes on the screen, and don't forget to subscribe to the channel for more. Thanks for watching.